And we're going to talk masks in a minute. You have one with you?
Well, I certainly do.
It's upside down.
Yes, let's get it the right way up. There's a mask that I purchased, and I'll just say that on the packet, I was very interested to see it was reusable. I shouldn't wear it if it smelt. It said, put it to one side if it smells, put it in a ventilated place, or wash it. Don't use it near an open flame. Not suitable for children under 16 years old unless under adult supervision. Not for use in a medical environment or as a dust mask. Replace it if it becomes too loose. And it was made in China, so that should fill you with confidence.
Good, that's good stuff. Well, I mean, aside from masks, of course, we're not allowed to be obese anymore, Brian. And in fact, they're going to stop us being obese by banning advertising of foods that contain fat, sugar, and salt before 9 p.m. So that's going to solve the problem.
I will be interested to see that actually when the power of some of the big producers is brought to bear.
Well, they're claiming that they're going to fight these big producers, but I will suspend my disbelief until we see the outcome of that. But in the meantime, the Telegraph and the Mail and a whole bunch of others talking about the teachers' unions calling for compulsory face masks for school children. At least 10 schools, they say, have decided to break with the official government guidance and make face coverings compulsory or strongly encouraged when pupils return in September. But the unions are saying, really, well, Pat Roach, who's the General Secretary of the NSUWT, Teachers Union, said the government's guidance for schools is now out of step with wider public health guidance and guidance to other employers, where it's recognised that where physical distancing cannot be assured, face masks should be worn. David, what are your thoughts on that? Welcome to the programme.
It's remarkable that there is no government policy so imbecilic that some official won't make it actually very much worse. So we've got a situation where children are not at risk from COVID, they're more at risk from lightning strikes, and because of this, and having seen the COVID levels fall away to next to nothing, now we're going to force them to wear masks for how long? Well, presumably until there's a vaccine. None of this makes any sense. None of it's rational. None of it's clear thinking. It seems to be driven by something else. Fear, for sure, and this desperation that now we're told to worry about a certain thing, we must worry about it until the point of the policy becoming absolutely ludicrous. I don't think that parents will be very impressed with this. I think there'll be a great deal of pushback, and we'll see if the unions can form a more coherent, rational policy.
I don't think they will, because they're largely driving this at the moment. But last Wednesday, I think it was, Brian highlighted this document here from the Academy of Medical Sciences, preparing for a challenging winter 2020-21. Brian said, well, we're going to cover a little bit on that day, but we would have to continue looking through the document and see what's in there. Now, of course, also last week we were highlighting the fact that that in Europe, at least, and in the Republic of Ireland, the idea that a person's home is their castle is being broken down. Well, perhaps we get a further clue that that's what's coming for us as well in the UK, because in this document, it says further research is needed into the value of face coverings in specific subgroups, e.g. children, as we've just seen from the teaching unions, but also the effectiveness of face coverings in different settings, e.g. households, in reducing transmission, and how face coverings should be or could be encouraged as a social norm. Now, this is pretty fantastic, Brian, because that absolutely fits into the SPI-B advice to the SAGE and the idea that you've got to discredit people that aren't prepared to follow the so-called public health advice. But this idea that households, that we would be mandated to wear masks in our own homes, this seems like the government stepping a little bit too far.
Well, it's way too far, Mike, but the stepping process has been salami slicing to mixed messages there. They have been creeping towards more and more power and getting into your home and allowing officials to come into your home is one of the key objectives. Takes me back to that German lady who talked to us about the rise of the Nazi system, and she said it was drip, 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 like the drip of an anaesthetic, and then she said more power to officials until you had more and more people who could walk into your home. So she described the culture change. We're watching it.
Yeah. Now, last week, Brian, you mentioned Asthma UK. Just remind us the context.
Well, because basically a gentleman who suffered from asthma did not want to wear a mask. He thought it was going to cause problems, so he made a telephone call to that charity. I was present at the time when he asked about people with asthma having to wear masks, and a very helpful man in Asthma UK, or at Asthma UK, said, well, actually the guidance says that if you've got a good reason not to wear the mask, it causes you distress, or you've got medical problems, you don't have to wear the mask. And indeed, we print a certificate which says, I've got sort of issues, I've got problems, I don't have to wear a mask. And he directed us to where we could print that off on the website.
Well, so it's this is a little bit strange then, because the question on the Asthma UK website is, should I wear a face mask or face covering? And the answer is most people with asthma, even if it's severe, can manage to wear a face mask for a short period of time and shouldn't worry if they need to wear one. Wearing a mask does not reduce a person's oxygen supply or cause a buildup of carbon dioxide. You may have read stories that say that it can, but this isn't true. Well, I'm sorry, Asthma UK, but that is a downright lie, because as the UK column has highlighted over the last couple of weeks, scientific paper after scientific paper is discussing this issue, and they absolutely establish that those things are true. So I'm not quite sure what has happened here, but perhaps when we start looking at Asthma UK's corporate partners, we get a clue. AstraZeneca, Orion Pharma, and so on. So I don't know what's happened there, Brian, but that does seem a little strange that somebody's saying one thing on a telephone line and publishing something else on their website. Well,
this appears to be like an astonishing turnaround. Need to do a bit more work on the website to see what is there and what's not there. But if this statement has gone up and they've removed the certificate, it's a very simple little certificate you could print off, which at least gave you something that you could show as a reason, a legitimate reason why you shouldn't be wearing a mask. If they've taken that down as well, then clearly something very underhand has gone on here. Now let's contrast that story with these reports. So we've had a couple of UK column emails, and this first one says it all. Yesterday, an elderly lady came into my charity shop wearing a mask. She started to stagger slightly and looked very distressed. I asked her if she was okay. She said she did not feel well and thought she was having an asthma attack. I was worried she was going to collapse. I suggested she remove her mask. She did so and said that they caused her great physical and mental distress. Following a telephone call, a close relative came and helped her out of the shop. So that's a pretty factual report, and I know exactly that report is complete and accurate. We have this one. I am a qualified GP. I was recently using the London Tube. As I came down the steps after crossing platforms, I passed an elderly, rather overweight man. He was wearing a face mask, but I could tell from his unsteady gait and eyes that something seemed wrong. A few steps on, and I decided to go back to him to ask if he was okay. He'd pulled his mask down, his breathing was laboured, and I noticed his lips were bluish. I immediately got him to remove the face mask and told him the mask could impair his breathing. He told me he'd had severe pulmonary problems. He had no idea masks could be dangerous for him. So this is qualified medical opinion warning of the dangers, particularly to people with problems. And I'm just going to highlight this, and I know that Mike, you covered this on Friday, but the BBC with promotional videos about why people should wear face masks. And in this clip, it stresses that you must make sure that the mask covers the top of your nose and your mouth, and there should be no gaps, so it's under your chin. but there's absolutely no warnings at all by the BBC that these masks can be dangerous to people. So a complete lack of due diligence by the BBC. And then on a positive note, we had this email. Yesterday, I visited a large Tesco store with my girlfriend. I refused to wear a mask. Fortified by my present, my girlfriend refused to do likewise. I could see that many customers were not happy wearing a mask because they removed them at once. The second they departed the store. However, within the store, including us, there were only 4 people I could see without masks. One of these, wearing a Harley Davidson sweatshirt, spotted us and at once removed his mask. As I said to my girlfriend, it requires a leader to remove the sheep from their pen. So dangers of masks being reported by NHS staff themselves, and yet they're being promoted with no warnings by many organisations, including the BBC.
And I noticed that was another video where the colours chosen just happened to be the same colours as the Chinese flag.
Yeah.
Absolutely. David?
I find the comment, the revised comment from the Asthma UK organisation very troubling. I've witnessed on videos on YouTube of people conducting experiments, putting on a mask and monitoring the level of O2 that they are breathing in. And they're getting something like 17 to 18%, and the device they're using has an alarm going off. UK requirements here for tunnelling, for oxygen deficiency. At 19%, there's a high level alarm. BS 6164 2011 covers this. The high level alarm means there's an atmospheric problem. The tunnel should be evacuated in accordance with the emergency plan. Self-rescuers, which is breathing apparatus, should be worn immediately. So at 19%, if you're in a tunnel, it's oxygen starvation and it's an emergency. But we are putting masks on people to reduce oxygen levels to 17, 18%. And there's no problem with this. And we're doing this for the elderly, for the infirm, for people who are overweight and out of condition, for people with all sorts of illnesses. It's astoundingly reckless is what it is. Now, I've been asking the Scottish Government now for 3 weeks for their risk assessment on this policy. I'm still waiting. I've been told that on August the 7th, I will get a reply. So I'm looking forward to that. Where is the assessment of the dangers that they're putting the public to?
There isn't one. Brian's asked for risk assessments. Many of our viewers and listeners have written for risk assessments. No one as yet has managed to get any acknowledgement from anyone that there is such a thing or that any consideration has been given to it. These people aren't stupid, I don't believe, so they know exactly what they're doing.
Well, they know that they cannot produce a risk assessment, because if you did a proper risk assessment on masks, the minimum that would come out of it would be caveats on certain people who had medical conditions. They daren't do a risk assessment, but of course, because of course that would be the lid off Pandora's box, and people would start to realise that these things are not without risks.
Yeah. Okay. Perhaps an indication of how long a slog we have ahead of us with all this nonsense. Our last wills and testaments will now, the government is going to legalise the remote witnessing of wills, making it easier for people to record their final wishes during the coronavirus pandemic. They're going to do this through legislation in September. So they're going to actually take a piece of legislation through Parliament in September. This is not, in other words, we're not coming out of this emergency situation anytime soon, because if they're bringing legislation of this type into Parliament in September, it's going to take several weeks to get it through. And then why would they do that if they're intending to relax the emergency situation within even weeks or months? They wouldn't. This is going on for a very long time. They're saying that these changes will be made, as I say, via new legislation, but crucially the move maintains this vital safeguard of requiring 2 witnesses, protecting people against undue influence and fraud. Those witnesses won't be in the room at the same time that the will's signed. They'll be on Skype or on Zoom or something like this. And the measures will be backdated to the 31st of January 2020. This is the date of the first confirmed coronavirus case, meaning that any will witnessed by video technology from that date forwards will be legally accepted. Fantastic. In the meantime, just to give an idea of how ridiculous things have got, this is news from Vietnam, and Vietnam has decided to evacuate 80,000 people from a city after 3 people tested positive for COVID-19. David, I don't know what your thoughts are on that. I see you laughing, but this is, I mean, where does this end?
Pol Pot is where it ends, and he evacuated a few people from cities.
Absolutely.
Well, this is the question. Where do you go with this? It's fear. It's entirely run by fear, and the fear now seems to be affecting our wise overlords as much as anybody else. This is completely irrational. Something which has got CDC reckons a 0.26% case fatality rate. That's probably on the high side. It's no more harmful than seasonal flu. It's a lot less harmful than TB and a whole raft of other things that we deal with as part of the normal risks of being alive. But because this has got this media coverage and focus, everything's panicked. Everything's irrational. Where does it end? Well, it ends, I suppose, in some very nasty totalitarian way where your health and everything about you is monitored by the government in case you are deemed a risk.
Absolutely. But of course, a lot of this hype and furore is being created by the testing regime. Well, the world-renowned, according to the government, UK Armed Forces, I'm not certain that the government considers them world-renowned, but anyway, that's another issue. So the military mobile testing units, which have been deployed, thousands of personnel at short notice to support the coronavirus testing regime in the UK. They've been working alongside NHS staff and civilians at regional sites around the country and in mobile testing units, because as we know, under the plans for EU defence, as an example, military and civilian institutions begin to work together, and there's fusion doctrine at work, of course. The mobile testing units provided a vital role in helping essential workers who were the most vulnerable to the virus assess tests, but this is being handed over to civilian only staff from now on. Ben was very excited about it. He said thousands of armed forces personnel were stepped up to serve in the front line in the fight against coronavirus, but they're being stood down from that. I don't know what your thoughts are, Brian.
Well, I just find the whole thing outrageous, Mike. We've supposedly got a threat as well, you know, with China and Russia, that we're supposed to be bringing out all of our armed forces to a higher state of readiness. Now they're involved in doing this with COVID, and of course we've got 77 brigades spying on the British people. So there's something outrageous going on, and the military have been drawn into it. Just to give you this one, we'll end the COVID section on this. And the reason that these emails are starting with yesterday was because we'd done a report talking about masks and people had responding. But this one says, yesterday I met an extremely senior NHS colleague. When I last spoke with him, he was adopting COVID social distancing and was extremely cautious about what he said with regard to COVID and protective measures. Yesterday, he was a changed man and stated that he did not believe in nor support the current COVID policies, believing them to be implemented to, quote, control the public rather than to protect them. And I can tell you that the person who reported that to us is themselves very senior in the NHS. They were stunned but very pleased to see that this particular extremely high-level person had had a complete change of heart over what was happening. So progress is being made.